Sneeze may be on the stream. Hi, everyone. We are live here. It's a Monday night. This is kind of impromptu and last minute. I am your host, Nick Roome. We're not going to do the actual show yet. Hang on 1 second for that, just to explain to everybody what we're doing. We are live because by a stroke of luck, we got a complimentary pass for the International Symposium for Healthcare Human Factors. And by a stroke of luck, we will be there and we will be looking at things. So it will be a great time. And we wanted to provide a preview. So for anyone who's watching, this is gonna be real kind of quick and dirty. We're just gonna kind of look at some of these. We're gonna look at some of these track keynotes, some of these presentations, these discussion panels. What we're going to kind of divide and conquer. We're hoping to get some interviews for you all. We're hoping to provide some level of coverage around this conference. And, we'll see what we come out the other side with, but we will have something for you all. And what we're going to do right now is we're going to just do a quick recording of an episode where we break down just a quick preview of what we're going to look at. So what'll happen here is we'll take just a quick break, about 30 seconds, and we'll get going with the episode. All right, we'll be back in 30. All right. Hello, everyone. This is a special bonus episode of Human Factors Cast. We're recording this live on April 12th. I'm your host, Nick Roome, and I'm joined today by someone who we haven't seen in quite a while. Miss Elyse Hallett is over there.
How are you? Hey, how's it going? I am fantastic. How are you doing, Nick?
I'm doing great. And the reason we have you on the show is because I feel like it's an almost annual tradition at this point. Healthcare Human Factors. The annual symposium actually starts this week, and you and I are fortunate enough to go. Full disclosure, I got a complimentary pass from the folks over there at the International Symposium. So, thank you to them for providing me access to this event. So, with that said, what we figured we'd do today is just kind of a preview. We've done these in the past. We've kind of looked at what's going on at these events, and it's just a kind of quick overview of what types of things that we plan to attend. Today was technically the first day, although it was mostly workshops. Neither of us attended any of those. And so I guess we can kind of just go through these. We have it up on the screen if you're watching live with us. Thank you. If you're not watching live, we will describe these best we can. We're just kind of figuring this out on the fly. So we're going to go through these. The first one that we have up here is PS1. This is the track keynote.
Yeah, and Nick, actually, I'm going to interrupt you since we're winging it.
Yeah.
Do you think we should do a quick overview of the 4 different tracks that they have?
I think that's a great idea. You're the expert here. Look, Elyse, you're the expert here. You've been to this a million times, and actually, I want to go over one additional thing before we get into that too. So yes, please do.
Do it.
Please go over the whole thing.
Oh, okay. All right. Well, actually, if you go back to the view that you had before, that was a good cheat sheet for me. So every year, the Healthcare Symposium breaks down their talks into different high-level topics. And so the topics that they have are digital health, education and simulation, hospital environments, medical and drug delivery devices, and patient safety research and initiatives. And this is just a really nice way of breaking it up. So if, for example, you're a practitioner who is primarily interested in developing medical devices, then there's one track that's kind of geared towards you. Or if you're an embedded human factors professional in a hospital, the hospital environments is more geared towards you. So it's kind of a nice way of breaking up each, all the different topics based on, what the the high level interests are of the people who are coming into the healthcare symposium. So digital health talks a lot about just that, like how health is being represented digitally. We're getting into a lot of new ages with apps and data visualization and all that. Education and simulation touches a lot on, how we use simulation. It's a really big topic in healthcare, right? Because you can't just, go operate on someone if you're just learning how to be a surgeon, for the first time. And so there's a lot of implications in how that's done and making sure that that's done effectively. Hospital environments, I actually find that one to be one of the most interesting ones, because it's really human factors out in the wild. Like, a lot of times today, there's a single human factors person who is embedded in a large hospital. And so how does that human factors person fit in the hospital? Who are they working with? How do they get embedded in the processes to really make effective improvements? A lot of topics touching on that, especially because this is really an opportunity for those single human factors people to come together and learn and share lessons learned across their hospital environments. And then patient safety research and initiatives, really focusing on that safety component that is so big on human factors in healthcare. How can we really ensure we're providing, safe and effective, support for the patients? So that's kind of high level overview, but what we'll get into in a minute are some of the specific talks that are included in each of those categories.
Yeah, I can't describe how late breaking this is, and why we're so lack of prepared, and which is why I didn't even think about doing the overview. So thank you, Elyse. That is tremendously helpful for us to kind of visualize or hear about what these 4 tracks are. 5 tracks, 4 tracks, 5 tracks, 4, 5.
I think I said 4, but it's actually 5.
There's 5. So I do, for anyone watching or listening, I can go over just briefly what the interface for these virtual events actually look like. And it's actually quite nice. So if you go, if you are registered, you can actually get in here, and it's kind of cool. You can go to the main hub page, which actually has, if you were in like a hall for a conference, you have different rooms with different things going on, and you can kind of navigate to them. But what we're going to do here today is just kind of go through what we plan on attending during this event. And like I said, we're kind of figuring this out as we go. This might change, but again, we wanted to provide just a little bit of preview. So in terms of, I've added your schedule to this, Elyse, as well, so that way we can kind of just go through, and if there's anything missing, feel free to jump in. But I believe this first one is you. Do you want to talk a little bit about this one?
So this is actually the opening talk of the session, which I always like to attend because, it's typically, the keynote of the symposium, and sometimes they bring in someone who's, a bit unique of a background, that provides a different perspective. Sometimes they bring someone who's really embedded in the field, but this one's really focusing on, talking about this like, what is good enough. And, a lot of times when, we're working in this human factors field, we're butting up against people who are really focused on time and money, right? Those are the big constraints that we're working against. And so what is the point of good enough? And I think that's such a harder line to find in healthcare, right? Because it's not just, some app that you're going to sell, online. We're talking about like human safety on top of it. So, it becomes a much finer grain line to try and find out in this field. So I'm pretty excited about this. Usually the opening sessions are very good. So I'm excited to kick off the session with us.
Yeah, I would say the opening sessions are some of my favorite in these conferences. I think there's a lot of really fun topics to talk about in these. And I like that not all of them overlap. I don't know if all of them are separate, but they do have some that are not overlapping, right? So like I'm going to this education and simulation track keynote here. And this one, again, it's one of these opening sessions where they talk about sort of right now, this is education and simulation, right? So and full disclosure here, this is my first time going to a healthcare symposium, so it's going to be a little different for me. I'm completely out of my element here with the healthcare stuff. And it's gonna be fun experience. But this one looks like measure twice, cut once, using simulation to get it right the first time. So that'll be a fun keynote, hopefully, to listen to. I don't remember if this one's mine or yours, Elyse. Do you remember pushing this one up?
That one might have been one that I pushed up. So just getting a sense, this I think is in the medical devices track. And this is one that I'm always interested in because I think it's my second favorite track. Not that we have to play favorites or anything,
Right.
but just, getting a sense of what's coming down the line, what's, how is this expanding beyond, I think a lot of times we hear about, well, especially in San Diego, I hear a lot about diabetes pumps and certain apps. And so understanding like, how is this really going, to evolve? How is the technology getting more advanced? So, just kind of keeping a pulse on, how things are evolving in this particular area.
Right. I don't know if we said it for the audio, but it's human factors in advanced technology. I'll try to read those off a little bit better here. So the next one here, can cognitive assessment games save us from cognitive decline? So this is, if you can guess, this one's mine. I chose to go to this one here. Surprise. We're still on Tuesday, by the way. So this one, I think, is going to address exactly what it sounds like. Can these cognitive assessment games save us from cognitive decline? I know, Elyse, you're tight on time, so we're gonna just go through a little bit more of these as kind of a preview here. But you want to talk about this next one here?
Yeah,
COVID
this one's
environment.
definitely mine. So one of the things I was really interested in this particular year at the Healthcare Symposium is how they are going to bring in COVID. It's the hot button topic that everyone's talking about, but I think there's been some really interesting challenges that have come about, from a human factors perspective, that we're now starting to fully realize, right? So there's a couple different talks that touch on COVID specifically. So here talking about communication, which I always find to be such a fascinating topic in human factors because there's so much variability that's included in it, right? And then there's one later on in the session that is something like implications for human factors or something like that. But anyway, so all the COVID ones I've been really interested in attending. So I'm really looking forward to this one tomorrow.
Yeah, this is interesting because COVID kind of shut everything down right as the symposium was happening last year, right? So that kind of threw a wrench in our plans for any coverage there, and it was a mad scramble to even get something together. So now that we've had kind of a year with it, how did it change things? So the last thing here we have on Tuesday is simulation for design and diagnosis. I think this is something I put in there, and if it's something that you did as well, at least let me know.
No, this is all you, Nick.
This is all me. Yeah, I'm the simulation stuff. That's all exciting here.
No, I'm excited to hear your take on it, though. It sounds interesting.
Yeah, I think, well, what's interesting is that we're both attending very different tracks and very different types of talks. And so it'll be kind of fun to debrief and see what the other experienced. Okay, so we're on Wednesday now. First thing Wednesday, chatbots and gamification. Again, can you guess who put that one in there?
I'll give you two guesses, audience.
That was me. So that one should be fun. Simulation for virtual and real world studies. Again, who could have possibly put in a simulation for virtual things? That was also me. So I'm excited to I kind of focused my stuff on my interests because I feel like that's where I'm going to draw most of the connection, and you can kind of tell that hopefully me having some knowledge of those areas coming into this new domain for me of healthcare human factors, it'll be an easy transition, and I'll at least have something to talk about and bring you all. Aging and accessibility. Oh, sorry, go ahead.
I was just going to say that's the awesome part about this particular conference is though, yes, it's all focused on healthcare, the different flavor of it, they bring in so many differences, that really, I think, hit at a lot of people's interests. So I think you're going to find interest in a lot more of these talks than you expect.
I'm excited. Last up, Wednesday. Wednesday looks a little bit light, but hopefully we'll be able to fit in some interviews there. Aging and accessibility. Yeah, this one, I think, did you put this one in, Elyse?
I think this was you, but
It
I
might have been me.
definitely am
It's
interested in it.
I think I may have put it in just as a this looks interesting to me, and we'll go to it. See, we're very prepared here tonight on the show.
Yeah, I think I have a couple more that I need to add in here.
Do you want to talk about them? I think we may have flagged them earlier on this one here. Let's see here. We're on Wednesday. Do we want to go through some of these? So we have built environment.
Wednesday is the pandemic responses in hospitals, human factors considerations. That was the one I was talking about earlier. I'm really excited about that. Mm-hmm.
There you go. Yeah, so that'll be fun. Let's move on to Thursday here. I put in this panel for behavior change. I think this one might be a fun one, especially because a lot of my history has been with working with people to change behaviors, whether it be for environmental causes like pro-social behavior. So this one will kind of be interesting to me to see kind of what applications in the healthcare field they'll pull in with that.
Yeah. This next one was definitely me.
Yeah. Why don't you talk about that one here?
Yeah. Flow disruption. So that kind of touches. So this next one, it's called methodologies and challenges associated with exploring flow disruptions in hospital environments. And this is always an interesting topic for me, partly because a bit of my background dealt with this exact topic. So just understanding like when something happens, let's say in the operating room, there's some kind of interruption or disruption to the flow of things, and how do we, because they've been associated with inefficiencies and potentially much more negative, serious implications, and so how we study that, how to understand what are they, and then try to provide interventions or solutions to mitigate those flow disruptions, is kind of where the interesting part of it is. So I'm excited for this one. And actually some of the folks on this panel or talk, I either know them or recognize their names. So I think it's going to be a good one.
Oh, we'll have to make a disclosure when we talk about it. So Thursday's going to be a little bit lighter for me, only because Thursday's the day that we actually podcast. So we'll still bring you a normal episode on Thursday. So stay tuned for that. And then was there anything else on Thursday that you're attending? I think it was a lighter day for both of us.
Yeah.
Let's go ahead and talk Friday. So first thing in the morning here, Friday, data visualizations. I'm always down for some data visualization. It'll be exciting to see if there's anything that practitioners can take away from this and bring into their own application areas. And it'd be cool. I always like seeing what other areas are doing and seeing if that applies to the domain that you're in. So that'll be fun to talk about.
That sounds interesting.
I feel like this next one here, stories and lessons, what works and doesn't in collaboration between your human factors team and key team stakeholders, is an Elyse topic.
It absolutely is, because I mean, that's exactly the problem that I'm trying to figure out right now. And I think there's a lot of lessons learned we can beg, borrow, and steal across our different domains. Even if I'm not in healthcare, I think there's probably stuff that I could take away and still apply.
All right. And then this next one here, I think we both are interested in this one. It's applying human factors engineering to reduce severe maternal morbidity and mortality. This is an incredibly important topic. And especially, I don't know. I'm not a woman, but I know that there's a lot of mistreatment when it comes to maternal care in hospitals, and I think this certainly could be eye-opening to a lot of people, and put it that way.
Mm-hmm.
Anything else to add to that one, Elyse?
No, I think that you covered it pretty well.
All right. And then, of course, we have the closing remarks and discussion. So that's going to happen. This, again, was a very small slice of the International Symposium on Human Factors in Healthcare. This is what we're attending. If anyone who's listening or watching is going to some interesting things and wants to talk about their experience, please reach out to me. You can reach us at our website. It's humanfactorscast.media. You can leave us a voicemail there. We'd love to hear from you about your experiences. You'll hear plenty from Elyse and I later this week. We'll be back. So if you're watching this, be sure to hit the notifications so that way you know when we go live to talk about this. Otherwise, you'll see it in your podcast feed. And I think that's going to be it for today. Let us know what you guys think of these little previews. Again, it was kind of late breaking, and so it wasn't as organized as we've been in the past, but we wanted to bring you all something to show that, yes, we're going, and two, we've thought about what we're going to. We've at least prepared that much. So you can hang out with us on Slack or Discord if you want to get or follow us on any of our social channels. Visit our official website, sign up for our newsletter, stay up to date with all the latest human factors news. If you like what you hear, you want to support the show, there's a couple ways you can do that. You can leave us a 5-star review, tell your friends about us, or consider supporting us on Patreon. We are completely listener supported, so any help you can give definitely helps. As always, links to anything that we talked about here is going to be in the show notes. And you know what, Elyse, thank you for joining me today. Where can our listeners go and find you if they want to talk about healthcare symposium stuff?
Probably right now, LinkedIn is the best way to find me. So you can find me at Elyse Hallett.
Great. As for me, I've been your host, Nick Roome. You can find me streaming on Twitch tomorrow for office hours and across social media at Nick_Roome. Thanks again for tuning in to Human Factors Cast. Until next time.
It depends.
All right. We'll give it a little pause. Thank you, Elyse. And thank you, everyone, for hanging out with us. I know it was a very quick episode. It was like, 15, 20 minutes. So it was just a quick preview. And if you're watching, thank you. I didn't expect anyone to jump in, but there's a couple of you on here. So Elyse, we'll talk tomorrow. We'll try to get some coverage going. And for everyone else watching, thank you.
It's going to be an awesome week. I look forward to it, Nick.
All right. Well, I know it was a short stream, but thank you, everyone.